In this video, I'll be showing you how to measure and record urinary output. Now, for this patient, he has a catheter with a drainage bag, okay? Right here, I kind of made shift a spout because I wanted to be able to kind of give that release valve feel, that or port feel. It depends. The bags are all different for the catheter bags. However, for the drainage bags, however, I just wanted to be as real as possible because, again, this is a cis bath bag. So, as you know, with that, you have to release it this way to get the water out or let it spew out through the cord. And I didn't want to do that because it'll mess up the setup. Okay? So now I'm going to go ahead and get started. I just wanted to explain that to you first. Hello, Mr. London. How are we doing today? Good, good. Well, my name is Kristen. I'm a CNA student from PG Community College, and I'm here today to measure and record your urinary output. Is that okay? Okay. Just give me a couple of minutes so I can get my utensils, and then I'll get started. Okay, so I already have my utensils ready. I have a waterproof cloth right here. I have my graduated cylinder to measure. And then I have some paper towels here. One to wipe and to kind of move this with. Okay, so now I'm going to go ahead and get... Oh, and I also have my bedside commode here. And then I also will have another chair. No, I'm not going to use the chair. What I'll do is I'll go ahead. I have another waterproof cloth that I can use as my barrier. So now I have two. So what I'll do is I'll use another waterproof cloth as my barrier for my table, and I'll put it this way in front of you so you can see me measure. And we'll just, for the clinical setting purposes, we'll just say I'm over on, in a corner or something like that. That way you can see everything good. Okay? So I'm going to go ahead and finish with my patient. Okay, Mr. London, I've got my supplies, and now we're going to go ahead and get started, okay? Close the privacy curtain. I'm going to wash my hands. I'm going to go ahead and grab one of my waterproof sheets. I'm going to go ahead and put that on the ground, right under where the catheter is. That's just in case there's any spills. Next, I'm going to go ahead and grab my gloves. I can see right now from the way the camera is angled, you're not going to see me if I get down and try to pour drain out the urine into the graduated cylinder on the ground. So what I'll do is I'll bring over a chair before I do that, so that you can see it, draining into the graduated cylinder and not splashing. Okay, Mr. London. So what I'm going to do is your bed's already lowered to the lowest position. Move your call button. I'm just going to check your drainage here. So what I'm doing now is I'm just going to make sure that all his new urine and everything is drained to the bottom. Make sure that's good. And this one already has a little thing right here to cut it off, so I don't have to pinch it myself. So I'm just going to go ahead and release and put it right back in place. Okay, so it's pinched off. Now what I'm going to go ahead and do is I'm going to go ahead and grab that chair like I told you so you can see. This will be the other waterproof cloth that I was going to use on top here anyway. I'll bring that here. Yeah, that's much better. I'm going to grab his drainage bag. Okay, now this is going to be the makeshift tip that I made for it. So we're going to say that now this is me pulling the tip out of the hole, and or like some of them have a spout, so it's a hole right here and you can pull it out and then you can release the valve. So that's just say that's what we're doing. Okay, so, and I only had that tape on there just because I didn't want the water coming out before I was ready to release it. Okay, so now what you're going to do, you want to be careful not to touch the tip. Okay, that has to always stay as sterile as possible. So now what we're going to do is we're going to release the water, and we're going to make sure not to touch the spout. You doing okay, Mr. London? Okay, good. All right, I got all of it. So now what I'm going to do is I'm going to bring it back up. I'll grab a alcohol swab that I've already had over here. Just going to wipe off the tip, throw that away, and then I'm going to say that we reinserted it back on the side here. Now we're going to put the bag back down on the bed. Okay. All right, and we're going to grab this from here and bring it up here to make sure we get an even measurement. Or I could have bent down, but I don't want to contaminate my clothes, so I just decided to bring it up to eye level. I'll move this chair out of my way so I don't trip over it. All right, so now I'm going to look at it, and it's looking like we have 600 milliliters or cc's. Your urinary output is very good, Mr. Lunyon, very good. So now I'm going to remove my gloves. I'm going to wash my hands. And I'm going to record. Now, in order to record, it's a couple of things. Number one, you need the time. My time is 2:30. Number two, you need type of output, urinary. Number three, you need amount of output, milliliters or cc. That was 600. And then last, you need your initials. I've completed my record. Now I'm going to finish my cleanup. I'm going to grab my gloves one more time. Going to grab the barrier, the waterproof pad from the floor, rolling inward, and then putting in the dirty linens. I'm going to go ahead and grab my graduated cylinder, and I'm going to pour that out into the bedside commode. And now I'm going to go rinse it out. Now, I stepped away. So let's just say when I stepped away, I rinsed it out and I cleaned around it with water. This was my pad. I'm going to get that off of here. Put that in the dirty linens. Grab my towels and I'm going to go ahead and wipe it off. And this is to be stored in the soiled utensils. So I'll put that over there. Now, with my gloves and this, taking it off. Right in the trash. Wash my hands again. Okay, Mr. London, you had very good urinary output today. I'm really excited about that. I cannot wait to let the nurse know, okay? If there's nothing else you need from me, I'm just going to get you set back up in the bed, and then I'll check on you in a little while, okay? Okay. All right. The bed was already in the lower position, but always be safe. So I'm just going to lower it again, making sure. Okay. Here you go, Mr. London. Let me know if you need anything, okay? Okay. Grab my recordings, and I'm gone.